What is cost of care? This presentation is for professionals connected with an area agency. It is presented by Granite State Independent Living's Financial Planning and Benefit Services. First, before you learn about cost of care, please make sure you have reviewed the presentation on Home and Community-Based Care HCBIC waivers. Please note that this presentation is focused on programs for adults 18 and older. What is cost of care? If you have a home and community-based care waiver for a person with a developmental disability or acquired brain disorder, and you have income over the limits to receive Medicaid without a cost of care is the out-of-pocket amount, like a deductible, a person is responsible for paying to an area agency before Medicaid will cover their services. Please note that the notice that is received of what the cost of care is generated by the Department of Health and Human Services, DHHS, but the area agency is the one that bills the person, and the person is responsible to pay the area agency. Who may have a cost of care? If a person is still receiving cash assistance, they will not have a cost of care. If a person is still receiving a SSA cash benefit, they will not have a cost of care. If they're receiving Medicaid through a Medicaid protection because of SSI, because their SSI cash benefit went to zero, they will not have a cost of care. If they have a Choices for Independence CFI or an in-home supports waiver, they will not have a cost of care. Cost of care is applicable in cases when a person is receiving an SSDI cash benefit of $883 or more per month. Why doesn't one have a cost of care for a CFI or HCBIC IHS? For CFI and HCBIC IHS, the person's income is compared to the nursing facility cap, which for 2014 is $2,163. Therefore, a person will only have a cost for services if their net income is over the $2,163. Computation for cost of care. How is cost of care calculated? First, they're going to take your gross earned income, and they're going to disregard or take deductions out. Please note that if someone is working, they should not have a cost of care, so I will not go into detail about these deductions. The second step is they're going to add countable gross unearned income, including SSI. Unearned income being SSDI, unemployment, workers' compensation, SSI. Please note that SSI is subtracted in the later step. Right. Next, they're going to subtract allowable deductions. They're then going to subtract a $148 personal needs allowance if a person lives in independent living. They're then going to subtract the standard of need, which corresponds to the individual's living arrangement. If they live in independent living, it's $735. If they live in residential care facility, it's $915. They live in a community residence that's subsidized, it's $797. If they live in a community residence that's unsubsidized, it's $857. If they live in enhanced family care, it's $915. They're then going to subtract all Medicare premiums the individual pays for themselves. If the state pays the Medicare Part B premium, it cannot be deducted. They're then going to subtract all other medical expenses incurred by the individual that were not paid or plan to be reimbursed by a third-party payment. That can be health insurance premiums, deductibles, co-insurance, co-payments, for example. They're now going to subtract the SSI. They're going to add the VA aid and attendance allowance if it's applicable in the person's situation. And that's how they determine what the cost of care will be. For example, Steve receives SSDI of $1,000 per month off his father's record. He has no earnings and lives in independent living. His Medicare Part B premium is paid by the state, and he has little to no out-of-pocket costs. The first step is earned income. He doesn't have any, so we're going to skip to the second, which is add the unearned income, which is $1,000. We're now going to subtract allowable deductions. Steve doesn't have any, so that's $1,000 still in countable income. subtract the personal needs allowance. He does live in independent living, so we're going to subtract $148 to equal $852. That's countable. Subtract his standard of need. He's in independent living, so it's $735. That equals $117 in countable income. His Medicare premiums paid by the state. He doesn't have any other medical expenses. He doesn't have SSI, and that VA aid and attendance isn't applicable to him. So his cost of care will be $117. In example 2, Lincoln receives SSDI of $1,200 per month off his father's record. He lives in a community residence. His Medicare Part B premium is paid by him, and he has little to no out-of-pocket costs. First step is earned income. He doesn't have earned income, so we're going to skip to step 2, which is add the unearned income, which is $1,200. We're now going to subtract allowable deductions. Lincoln doesn't have any, so again, it's $1,200 in countable income. We're going to subtract the personal needs allowance. He doesn't live in independent living, so his countable income is still going to be $1,200. We're going to subtract the standard of need. He lives in a community residence that's subsidized, so that's $797. That's going to equal $403 in countable income. We're going to subtract his Medicare Part B premium, because he does pay for that. That's $104.90 to equal countable income of $298.10. He doesn't have medical expenses, he doesn't have SSI, and the VA aid and attendance isn't applicable. So his cost of care is going to be $298.10. If you have a cost of care, can you get rid of it? If you are like Stephen Lincoln and you begin to work, you can get rid of your cost of care. There's a program called Medicaid for Employed Adults with Disabilities, or MEAD, that you can enroll in, and your cost of care will go away. MEAD gets rid of your cost of care because the eligibility requirements are different and allow a person to have more income. There can be a premium for MEAD, which you can learn more about MEAD in the Medicaid presentation. Note about someone on SSI. If a person received a SSI cash benefit but lost it due to their earnings, they will be put into a Medicaid protection that will protect them from a cost of care. For more information on this protection, please see the Medicaid presentation. If someone is on SSI or had SSI and went to zero in their cash benefit, they do not need to enroll in MEAD because they have their own protection. Want more information? Here's how you can get more information. You can listen to the rest of the Financial Planning and Benefits Services phone number is 877-809-7028, and our email is benefits@gsil.org. Our website is www.gsil, the Work Incentive Resource Center, for more resources at www.nhwirc.org. Services for more details. Social Security's website is www.ssa.gov, and the Department of Health and Human Services website is www.dhhs.state.nh.us. If you are connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance.